culture demands that we deliver normally, and especially as African women. But there are times that it is not possible. There are times a woman goes to hospital, she's so determined to deliver like her mother did, like her aunts did. But the doctor, the midwife, the gynecologist, or the medical team comes in and they say, no, you cannot do it. Why does it happen? Kindly join me at Kijabe Mission Hospital as I join Dr. Lilian as we discuss this. Remember, this is your show, Golden Minute Show, and I remain your host, Ann B. Hello, Dr. Lilian.
Hey, how are you, Ann?
Thank you very much for sparing your time to be with us. This is where we are fighting against maternal mortality and fetal mortality. Of course, with love and passion. And congratulations. I see,
you.
No, you are our candidate.
Yes, I am.
I hope on that day, Labour will respect a gynecologist. I hope. Now, kindly, we want to discuss about cesarean section versus normal delivery. Many other times we have women who want to be operated on. They want to, you know, the language outside there, wanataka kuchinjwa. It's actually kupasuliwa. But you as a doctor comes in and says, no, we are giving you a chance to try. You can deliver. What makes you feel like 100% confident that this woman can deliver as much as she wants to be operated on?
Okay, one thing that I would say is that naturally human beings or women are supposed to deliver normally. That's the default God-given mechanism of siring children. Yeah, and there are a few reasons that may make a woman not be able to go through it, and that is through first having tried or having been assessed while pregnant to determine if they can be able to deliver normally or not. Yeah, but most of them will deliver normally.
So, other than a person requesting, so there's a person who can request to deliver normally, but now you still come in and say no. So there are some indications.
Yeah,
the cesarean section indications. Can you talk about them, please?
All right. So there are many reasons that would make a woman not be a candidate for normal delivery. And an example, the actually commonest reason for women going through cesarean is when there are reasons, when the baby is at risk or the mother is also at risk.
Okay.
Yeah, most of the times it's the baby who's at risk and therefore the mom cannot be able to push normally, and therefore they have to go through the surgery to deliver the baby as fast as possible. Yeah, so that is what we call non-reassuring fetal status. Yeah, where baby is at risk. There are other reasons whereby, for example, the baby is presenting abnormally. For example, instead of the baby coming with the head presenting first, there may be other parts of the body presenting. For example, the lower part of the body, the feet or the buttocks, preceding the other parts of the body.
So the head should be here.
The head should be the first body part of the baby to come out during labor. So in cases whereby it is not the case, then such babies have to be delivered by a cesarean. Okay. Yeah. In terms of this, the condition we call non-reassuring fetal status, there may be many reasons causing that. It may be an abnormal fetal heartbeat pattern. It may be because the baby has passed stool within the amniotic fluid, which may make the baby not be able to breathe so well, and therefore because of the heart rate abnormalities, again they have to go through a cesarean. It may be because possibly the mom may be having a bleeding problem, or the placenta of the baby has separated partly, and that makes the baby be at risk of dying inside if not delivered in good time. There may be also other reasons, for example, if baby has abnormalities which may make baby not be able to pass through the birth canal safely. For example, we have a condition called hydrocephalus, whereby the baby's head is bigger than the normal birth canal of the mom and therefore cannot pass through the canal comfortably.
Let me cut you short. I've seen some babies with very big heads in relation to their body parts. So you want to tell us that this problem starts when the baby is still in the uterus?
Yes, it's not something that just develops abruptly. It's a condition that develops over time. Possibly because of what you call congenital abnormalities of the baby, where the formation is problematic in terms of the development. Yeah, so it is a progressive thing that happens over months. And by the time the mom is getting to around 9 months when she is due for delivery, the size of the body is disproportionate, whereby the head is way bigger than the rest of the baby's body. Yeah, therefore it cannot pass through the canal well. Yeah.
So we've talked about the baby malpresenting and the malformations of the baby.
Yes.
Is there any other thing about the baby?
We have other things too. We have a few problems. For example, when a mother has ruptured the waters, the bag of waters has broken, and the cord comes first.
Oh, okay.
What we call cord prolapse. That can tamper with the breathing patterns of the baby. And if mom is not delivered within a very short period of time, the baby may actually die inside. Yeah, so, and a few times we have also other cord complications. So cord prolapse being one of them, we have what you call, for example, cord entanglement, where we have twins. For example, we have twins, and one twin is presenting abnormally, the other one is presenting maybe okay, or both have what you call malpresentation. And that may interfere with the normal laboring process.
Okay,
so
thank you. So you want to tell me it's not all mothers who have twin pregnancy that should be operated on? No, there are many categories of women with twin or multiple pregnancies that can actually deliver normally. Yeah, in case of multiple pregnancy, we'll have babies who are sharing sacs, babies who are sharing placenta, and babies who may actually be having separate sacs and separate placenta. So when they have different sacs, the complications are much less compared to babies who are sharing sacs, because the complications are much higher when they're within the same bag of waters. Yeah, and in such a case whereby they have one bag of water, they cannot be delivered normally, even if they're presenting okay, with the first baby coming with the head. Yeah, so such are straight indications for cesarean. In case, for example, the mom has had previous surgeries, especially on the uterus, whether it's previous cesareans or they've had a removal of fibroids on the uterus, that may be a straight indication for a cesarean delivery. Thank you very much. Yeah. Let's go for a break, and when we come back, we'll talk about it. Viewers, kindly continue using the number on your screen to reach us for your comments, for your questions, and even for your appreciations. Thank you very much for joining us once again. Remember, we are still at Kijabe Mission Hospital, where we are discussing about cesarean section with this beautiful lady. Actually, she's a gynecologist, Dr. Lilian. Yes. Now, Lilian, kindly tell us, does a woman have a right to choose on the mode of delivery?
Every patient, every woman has a right to actually make a decision as concerning her reproductive health. And even as women come to us for delivery, they have a right to information as to what is best for them. And however, we don't forcefully, we don't force decisions onto patients, because we have to respect patient autonomy. Yeah, so we know very well that the best mode of delivery is normal, but there are moments whereby we encounter patients who choose to have an elective cesarean delivery, which most of the times we are against, because we know the risks associated with each decision that they make. So it is upon us as clinicians to advise our patients so that they make an informed decision as to what is best for them. And in case whereby they are very adamant on choosing a cesarean delivery, they have to go through a whole process of counseling together with their partners, and so that they know the pros and cons of whichever method they are choosing.
Sure.
Yes.
Now, while we are still at the rights, sometimes it happens, a woman comes to hospital, she has a previous scar, and during admission, the midwife just discovers she has one previous scar, and she asks, kwa nini ulipasuliwa the other time? And the woman says, sikuambiwa. Does a woman have a right to be told, we are taking you in for an operation because of this and this, because of this and this reason?
Yes, they do have rights, and actually it is their right to know why specific decisions are being made for them. And it is also upon every woman to ask why that is happening. Because without that information, then that means that we are actually abusing their rights.
It is true.
Yeah, so it is illegal, or it is a crime for a woman to actually come out of hospital having had a major surgery and they have no clue as to why they actually went through that procedure. And at every decision making, when a patient has to go in for theater or for an operation, there is a signed form. It's supposed to be an informed consent given by the patient, giving permission to the hospital staff, the surgeon, the anesthesia team to actually work on her. So it's upon her to inquire why this is being done and what are the pros and cons of doing this specific surgery. Yeah, so they should be, patients should also be informed that they have the power in their hands to find out why specific decisions are being made. Yeah, regarding their reproductive health.
It's their life. It's
their
their
life.
body.
Yes.
It's their children. That is very, very good. Now, Daktari, there's something called elective cesarean section. Is it possible we talk about it?
All right. So an elective cesarean delivery is a planned procedure. It's a cesarean delivery which has been planned way in advance, scheduled on a specific day and time, so that it is done under a controlled situation. Yeah, it's the opposite of what we'd call emergency cesarean, whereby a rapid decision has to be made as to the delivery of a baby, either because the mom is at risk or the baby is at risk at that specific point. Yeah.
So basically, when we are talking about elective cesarean section, the mother will not go into labor at all.
They're not supposed to be in labor.
Okay.
Yeah. They're supposed to come at a specific time way beyond labor sets in for this specific surgery.
I guess maybe now the only advantage to this is that maybe the mother or the couple or a family has a right to choose on a birthday for the baby.
Yeah, it's an added advantage, though way low on the list, because there are many other considerations as to when the cesarean has to be done. Yeah, because first, depending on the indication or the reason for the surgery, the primary thing is having a mom who is safe and a baby who is safe. And with that, the maturity of the baby is a very big factor to consider. Yeah, for example, if a mom decides to have a baby delivered in May and the baby is actually due in July, so that is a whole big difference in terms of the maturity of the pregnancy. So you cannot choose to have a baby born preterm just because of the delivery
because that
date.
was your birthday.
No. Yeah.
That is very good. I heard you mention about emergency cesarean section. Now, when you come and tell a woman, we are taking you for an emergency cesarean section, this woman might expect now the next minute is walking into theater, operation and the baby. Are there some preparations that are done before, or what duration does it take, maybe from prescription to the actual operation?
When we talk about an emergency cesarean delivery, it's the main consideration is the indication or the factor that is making you make that decision. For example, if it's a patient who's bleeding massively, that means baby may need to be out
Soonest possible.
Yeah, soon as possible. If you're talking about a cord prolapse, if baby stays for more than 5 minutes, possibly that baby could die. So it depends on the indication, but at most, the time duration for an emergency cesarean delivery should not go beyond 30 minutes from the decision to actually surgery itself.
So the duration is maybe 30 minutes, but there are some that cannot wait for that.
There are some that will not wait for that long. Yeah, you'd already have had a mortality, either of the baby or the mom.
So, and at this time, the mother is being told, okay, we can still hold for 30 minutes. Or no waiting, no that call to your husband, no that call to your mother-in-law. We get in there. Now, I have had issues where actually some communities where women don't sign consent. What is your take about now specifically the operation consent? What is your take about it as a doctor?
The fact of the matter is that one's health decisions are in their hands. Yeah, because when a woman is going for surgery, it's not the husband who's being operated on,
Sure.
it's her. The only time that we allow other parties to sign the consent is if you're working with a minor. For example, a 16-year-old who's come and has to end up in surgery, you can allow an adult, like the mom or the partner who may be above 18 years old, to sign the consent. Otherwise, if any woman presents and to you in a facility and requires an emergency surgery and they are above 18 years of age, they have to sign their own consent, unless it's deemed impossible, maybe by the clinical status. For example, a patient who comes and she's in coma because of conditions like eclampsia, and they have to be delivered by a cesarean. In that case, you may need a close family relative to place the consent. Yeah.
Thank you very much. When we come back, we will know if there are any times when a doctor can do a consent for a patient. Now, back from our break, still with Dr. Lilian. Just before we went for our break, we were talking about the consent that a mother needs to sign before she goes for her operation. Now, Dr. kindly tell us, are there times when the doctor has to sign for the mother?
Okay, there are times when the doctor has to sign the consent for the mom, though very rare, and mostly it's because possibly it's a patient who is mentally unconscious to be able to place the consent. Yeah, and they're not even able to place their fingerprint on the consent form. For example, in some conditions like eclampsia, where a mom comes and maybe they had a convulsion and they're in a coma, such women may not be able to place consent, a written consent on these sheets. Therefore, the doctor may choose to do that. A few times you have patients who are mentally disturbed. For example, they have psychiatric conditions and they are not able to reason out on the need for a specific procedure. And the doctor comes in to explain to family and also get that verbal consent from family. And therefore, in essence, just consent for the patient. Okay. A few times we have very adamant patients, and for example, if you're in a situation of life and death, you may choose to do it for the patient so that to save the patient's life.
The doctor has a right.
Yes, at that point.
The woman says no, but the only way out is operation.
Yes.
So you can actually go and do it.
And medical legally, you will be covered.
That is very good. Now, Dr. Lilian, everything that has an advantage has also some disadvantages, the pros and cons. Could we please talk about the pros and cons of cesarean section versus normal delivery?
All right, starting with normal delivery, the advantage of having to go through normal delivery is that it's a process that ends up most of the time being without any obvious trauma in terms of the mom does not have any surgical injury, apart from a few cases whereby we are forced to create some cuts to aid in the baby coming out. So with that, you avert the issue of having to go through theater, through a major surgical procedure. Number two is that the blood loss is much lower compared to having to go through surgery.
In natural delivery?
Yeah, in the natural delivery. The third thing is that the hospital stay is much less in terms of the duration compared to a patient who's going through surgery. And again, the healing process is much faster. Of course, the bonding, that also helps in the bonding of mom to baby because of less pain and less hospital stay and less psychological torture of having to go through surgery and nurse the pain that comes after that. The downside is that, of course, the laboring process may be a bit devastating to enough women, and in our setting whereby we are not able to really cover our women very well during labor with pain control, it may be a bit traumatizing to the patient to go through many hours of labor. But eventually the joy of having a baby in your hands is much better than having to go through surgery. And also we have currently techniques that are able to support mom through labor, what we call epidurals, where moms have pain control during labor in specific settings, like the bigger facilities. Moms are able to have painless labor, and at the end of it all, end up with a safe delivery. In terms of a cesarean, of course, it's a major surgery, and with every surgery, there are complications that come along with that. There is the anesthesia itself, the drugs being used, which can be dangerous to the patient, and patients have died even before the surgery has started in the past.
Because of the drug?
Just the drug.
Now, not because of the reasons why they were going to theatre?
No.
The drug itself?
Yes. The reactions that they get from the anesthesia drugs. They are rare complications, but they've occurred before. So that is one, anesthetic complications. Secondly, the fact that it's a major surgery, there is the risk of massive blood loss and injury to other organs within, the neighboring organs to the uterus. The other thing is that, of course, when patient comes out of anesthesia, some will come out safely, some will come out again with more complications. Like infection.
Because of the same drug?
No, because of surgery itself.
Okay.
Yeah. For example, issues to do with infection, post-operative infection, more blood loss still, even after, having to nurse the surgery, the wound, and therefore the pain control is even, it has to be a bit more aggressive compared to a normal delivery. And the other bit is that even nursing the baby can be a bit difficult if the pain control is poor. And many women never think about even the long-term complications. For example, with every surgical exposure, the risks go higher and higher.
It's true.
So because when the body is healing, there is what we call adhesions, whereby there is scarring of the tissues within the abdomen. And with that, we have other risks that come with it, like obstruction of the intestines, and complications that accompany further surgeries later, because now you have organs being matted or kind of attached to each other. So later they may have more complications with subsequent surgeries. And the fact that you've had one surgery before, it means that the chances of having a repeat cesarean delivery is much higher.
It's much higher.
Yeah, than for a patient who's had a normal delivery.
Now, while we are at that, there are times a woman has delivered via cesarean section, but next time she's allowed to deliver naturally. How many times should a woman be operated on before we give her a chance, or how many scars do we try?
Okay. We only give a chance of one.
Only one scar?
Yes, and it has to be in a select group of patients, depending again on the reason why they went in to theatre. So if they've had one previous cesarean delivery, that means they have a chance of possibly trying to deliver normally in the subsequent pregnancy. However, there are things that we have to observe in terms of patient selection. For example, the duration from the first delivery to the next, which should be, ideally we give it around 1.5 years for proper healing of the uterus and also the wound itself. The other thing is that the size of the baby in the current pregnancy, if it is a baby who's way bigger, especially above 3.5 kilograms, the chances are we will not try to deliver that mom normally. In the subsequent pregnancies, again, we have what we call malpresentation, where a baby is not presenting with the head. Then we may not be able to try such a mom.
Now, allow me to ask you one last question for my viewer. What about the bleeding? There's that bleeding after delivery that goes for 6 weeks. Is it the same for a mother who has delivered via cesarean section?
The difference is not so big. In the natural delivery, we expect the bleeding to resolve in a few days to weeks. Yeah, most of the women will actually have resolution of the bleeding within the first 2 weeks. In cesarean, just because you've interfered, you've traumatized the layers within the uterus, you may find women taking way longer to have their bleeding stop.
Thank you very much. Well, you have heard it all from our gynecologist, Dr. Lilian. Kindly help us to help you. Remember, this is where we are fighting against maternal mortality and fetal mortality. We want to have you alive. We want to have your baby alive. Together, we want to be living. And now from Kijabe Mission Hospital and with Dr. Lilian, until we meet again, it's bye-bye.